Okay, so I'm going to go ahead and give a report of everything that I assessed. So we'll start by the top of the head was assessed. There was no dandruff noted, there was no lesions, everything was normal, the shape, the structure was good, it was normocephalic, the head was proportional to the rest of the body, and the everything was symmetrical as far as the palpebral fissures, the nasolabial folds. There was no like tics in the face noted. There was no abnormalities, no exophthalmos, no different like color skin pigmentations. I assessed cranial nerve 7, which is the facial nerve. That was good. There was no abnormalities there. Everything was equal, symmetrical. I got the patient to smile, to frown, things like that. I also assessed cranial nerve 5. That was the trigeminal nerve. The jaw moved good, without any restrictions. There was no pain in the jaw. The jaw felt good and firm and strong whenever the patient clenched down. I also assessed the maxillary and frontal sinuses, both of which they felt pressure but no pain. I also assessed the eyes. So I assessed cranial nerve 2, which was the oculomotor nerve. The visual acuity test, everything was normal. I assessed cranial nerve 3, which is cranial nerve 2 is the motor, and cranial nerve 3 was the ocular motor. And so when I assessed that, the pupillaries were equal, round, and reactive to light. I checked for accommodation, and that was normal. I also checked for cranial nerve 4, which was the trochlear nerve. So I checked to see, that's where they just followed the eyes and everything went good with that. Cranial nerve 6 was the abducens nerve. And that's the 6 cardinal gazes. They followed the pen light well. Everything was normal there. Also checked the lacrimal apparatus. Everything looked pink and good. I checked the nasolacrimal duct to see if there was any pain or if they felt any pressure under there. And besides what I was touching, there was no other pressure. I checked the cornea. The cornea was good. It was clear. I checked the sclera, which was white, free of any type of fatty deposits. I checked the conjunctiva, which was pink and moist, and that was good. I also checked the iris, which was, they were flat, they were round, the color was evenly distributed. I checked the eyelashes, those were evenly distributed. When they closed the eye, the upper lid went over the conjunctiva, which is normal. There was no bulging eyes or sunken in eyes. They were in the sockets just fine. The next thing I checked were the ears. So the ears, I checked the auditory meatus to the opening was good. There was no tenderness, there was no pain, there was no abnormal skin issues there on the ear. Everything was good. I also checked the cranial nerve number 8, which is the acoustic nerve. That all was good. So the next thing I checked was the nose. The patient did have a deviated septum. That was noted. There was no scaling, no lesions on the nose, no redness, no drainage. The nasal conchae was good. It was moist. It was pink. Also did a smell test, which was ocular nerve number 1, which is the olfactory. That was passed good. They were able to smell. They were able to tell what I was gave them to smell, which was toothpaste. The next thing I checked was the mouth. So the lips were pink. There was no cracking, no lesions. I checked the teeth. The teeth were a little bit crooked in some places, but free of decay, free of debris. I checked the buccal mucosa. That was good. That was pink. I checked the tonsils. There was no exudate on the tonsils, about a +1. They were visible. I also checked the hard and soft palate. I checked cranial nerve number 7, which was the hypoglossal nerve. That was good. Cranial nerve 7, where they said light, tight, dynamite, that was all normal. Cranial nerve 8 was the glossopharyngeal nerve, where they said and the uvula was exposed. The hard and soft palate worked in midline. They were all good. Cranial nerve 10, we did not assess. That was the vagus nerve. That was where the gag reflex was. Moving on down to the neck. So we checked all the nodes, all 10 nodes, is the preauricular, postauricular, occipital, submental, submandibular, jugodegastric. The It was the superficial cervical, deep cervical chain. It was the posterior cervical and the clavicular. So all the nodes were good. They were all movable, non-tender. They were palpable. There was no pain. Checked the trachea where I moved it on each side. That was even proportional. And then I checked the thyroid gland, which was not enlarged and free of bruise.